So that's the update from today's Daily Presser from Michael Gove. Let's get reaction to the government's announcements with Dr. Ron Daniels, an ICU consultant at University Hospitals Birmingham. Firstly, Dr. Daniels, how are you and your colleagues coping, and are you heartened by what you heard today?
So there's no doubt that this is a challenging situation. We all knew it was going to be challenging. It's challenging individual health professions, it's challenging the way that disciplines within healthcare work together, and it's challenging the supply chain and the procurement chain of this protective equipment. However, we are coping. We're coping through teamwork, we're coping through collaboration. Some chinks in the armour in the way the NHS gets supplies to the front line have been exposed, but the reality is that we have never been short of PPE when assessing patients.
You say you've never been short of PPE, but we saw the distribution problems in actually getting them to the front line. We hear from so many different medical professionals, the nursing staff, the cleaners, who are so concerned that they don't have the PPE when they need it. Is there not such a frustration that this is continuously happening?
So this is a problem. The problem arises because procurement and getting goods to the front line is devolved to individual hospital trusts, to individual departments within hospital trusts. So some areas will be good at acquiring PPE and distributing to their staff, and some will be less good. And that practice has to change, because we cannot allow any health professional to assess any patient who is thought to have COVID-19 without the appropriate PPE.
When it comes to, we're hearing about the ventilators, we're hearing about the testing that is being promised, the increases. What's your priority? What is the thing that you desperately need the most?
So you're quite right. We've heard about the tests, we've heard about the ventilators, we've heard about the PPE. But the reality is there is so much more that we need. There are some commonly used intensive care drugs that some organisations are falling slightly short on supplies for. It's not just about a ventilator on intensive care, it's about the pumps with which we deliver the medicines to keep the patient asleep, to support their blood pressure. All of these things we're needing in volumes we've never seen before.
And when it comes to testing, the government is setting out targets of 25,000 tests a day. They're not going to come until the end of April. Germany is doing tens of thousands of tests a day. Why are we not there?
I think before I answer that, it's important to remember that the tests themselves are not perfect. A negative test does not mean you definitely don't have COVID-19. A positive test is very likely to mean that you have it. So it's really important that we get tests to those frontline health professionals. I'm self-isolating right now because I have some fairly typical symptoms of this illness. It could just be a very bad cold. I'd love to know, because if I knew, I'd be able to get back to the coalface. But I've not heard anything yet about how those tests are going to be applied to me and my workforce on the front line.
So, Dr. Daniels, just to clarify, you yourself, you're in theory showing symptoms, but you haven't been offered a test?
That is correct, yes. And I think there will be many clinicians in similar positions to me who are frustrated at having to self-isolate at home when they know their colleagues are working their socks off to deal with this crisis.
So what is your message then to the government when they talk about these 25,000 tests a day by the end of April, when you need it now?
So my message would be to stop talking in big numbers. We know that there are huge stockpiles of PPE. We know that there are these tests being procured and available. We also know, as Hugh Pym pointed out earlier, that we're struggling to get some of the reagents, some of the chemicals that are needed. So we know there's problems and it's not easy. What we're really interested in on the front line is how we're going to get access to these. What does the distribution look like?
Dr. Daniels, thank you so much. We wish you the best of luck in all your work and all your colleagues on the front line. And also, well, let's hope that you get back to the desperately needed work that you are doing. Thank you so much for your time. Now, I want